Welcome to Benita's maternity program antenatal class. Today we're chatting with Sister Talia, who will be speaking to us about how to bath your newborn.
Hi, good day, moms. So I'm Sister Talia. A little brief introduction. I'm also a mom of three, a 2-year-old, a 7-year-old, and a 10-year-old. So I do know the challenges of a new baby and the big baby bath at home. So today we'll just be focusing on the first part is the transition. So within minutes of a baby coming into our environment, they are exposed to from this warm aqueous environment to this harsh reality, where they are now supposed to protect themselves against infections, toxins, and a change of temperature due to the transepidermal water loss. What will we need for a baby bath? We'll need some cotton wool. We'll need surgical spirit. So with cotton wool, it can be the round ones, the pads, or the balls, baby shampoo, a hairbrush, wet wipes, 2 to 3 towels, I always say, because mistakes happens all along of this baby bath. Vaseline, skin wash, moisturizers such as an Epizone or Epimax Baby. We're not brand specific, but those are quite easy ones to remember. White, clear, no perfumes, or it's preferable for babies. So we don't want any harsh chemicals. And then nappies. We get nappies that's already got umbilical cutouts, and if it doesn't, we just fold baby's nappy over. Clean clothes, cotton vest and crawler. So cotton is key. It's great for temperature regulation. So what do I need to do? Setup. This is safety first for mommy and baby. Temperature control and safety. So make sure your height is appropriate for you, so you're not bending down, especially if you've had a seizure or any type of uncomfortableness. We need to remember this is a repeated motion daily. So we daily, possibly, we'll deal with the chapter later of how often bathing baby. So we do want a comfortable environment. So a high table, a chair. And when I say safety first for baby, never leave baby unattended for a second. It may seem quite brief, but anything can happen. We want the door to be closed so we don't have any drafts coming in or out, because a newborn cannot maintain their temperature. We also want a towel on the surface and at least 2 towels for the drying. Temperature control is very important. So we start with the face. So with the face, we take 3 cotton pads. The first pad, we basically wet all 3 in our clean, nice, warm, fresh water. And what we do is we take the first pad, we take it in the corner of the eye, wipe and discard. Second one, wipe from the corner out and discard. We check it. We check if there's any residue, if there's any crusting, is it yellow, all those things is things you need to actually report to doctor, and especially if you've been cleaning for a couple of days and it's still not clearing. Natural water, we always say clears everything, but there's these things we look at. And then the third swab is to clean the rest of the face, so behind the ears, the neck, and those are all places we have vernix. So what is vernix? Vernix is this nice, beautiful, thick, waxy layer babies are born with. So we preferably, due to research being done, feel that we keep it on baby for at least 12 to 24 hours and let it absorb naturally. So when your baby is born and you hold your baby for the first time, let it even sink into your skin. It's great for your skin and also for protecting your skin. It's a barrier of protection. So with the first bath afterwards, there may be some vernix left in sticky and hard to reach places, and that we get rid of in time. And with this next chapter, hair wash. Vernix is also quite common to get in there, so we need to do it nice and soapy. So babies actually enjoy this part. We keep baby fully clothed, and then we basically cover baby with a towel, and we just keep baby like a rugby ball, like seen in picture. And your next, your non-dominant hand would be the kind of steering wheel for this. We take the thumb, as mommy has it on that picture, and your index finger on the other side, and you just keep it nice and close the ears. We don't want water in the ears, but we do want to get it nice and soapy. So we first wet with a non-dominant hand, we put a little shampoo on, and we lather off. We gently pat dry. After drying, we just feel with the inside of our hand or forearm if it is nice and dry. So it's basically the spot we feel, and we can actually rub the hair and feel it's dry. We want it dry for the regulation. We then brush. with that, we notice something we have heard of before called cradle cap. So it's normally quite a thickish, yellowish, or a little flakiness on the scalp. That is, we get so many shampoos now on the market for babies, especially for that. But if it's something that persists, it's something that you actually need to report to your sister, clinic sister, with your next visit, and they can actually see how we can facilitate the different medicated washes. Cap on to maintain our temperature. Now we get to our washing. So this is the part where baby may put up a fuss, and that's no problem. The reason is that's not that they don't enjoy bathing, it's actually the coldness of the exposure of the elements. So we say immersion bathing is preferable for babies. It gives comfort and it helps with thermoregulation, and that is why we do this rather every subsequent day than actual sponge bathing, because we want that comfort and it's a great bonding time with baby. So now we're undressing baby and we lather the body, either with the body wash of choice or with the emulsions that we've said before, like our Epimax baby. And we do this, after we do this, we do now submerge baby in the bath. It's very important to hold baby. So you support baby's head, and the other place them, the feet first in the tub. Their head and neck should always be above water for safety. And with this, you take your non-dominant hand, as mommy is keeping baby there in the picture, and you gently splash the water over tummy. They love it. It's also a great technique for cramps. So with that warm water going over the tummy, it actually helps them quite a lot. And you focus on under the chin, under the arms. Those are all places vernix actually still hang out a great couple of days after being discharged from hospital. And we make sure we get all the creases dry afterwards, and we dry baby gently, patting dry. We never rub the skin because the skin is so fragile. With this, we once again going to look at baby's skin. And when I say look at the skin, it's not hours on end. It's actually a quick glance. So we're going to see, is my baby's skin very red? If I touch it and I take my finger and I poke it and I take my finger away, does it have a yellowish tinge? Those are all signs of jaundice. So neonatal jaundice are quite normal for newborns, and we can see it a week or even 2 weeks after birth. And what it is, it's a normal production of bilirubin. So how does this get broken down? It gets broken down by baby feeding, baby excreting urine as well as poo, and we want that to happen. So as long as your baby is pooing and urinating, you know you're giving enough feeds in. So with that, we also have to see, is it lasting? So baby's already a week old, baby's not drinking, eating, then we know we need to take a next step, which is inform our pediatrician. We'll do on the next chapter a bit of jaundice and a bit of all the feeding techniques. But right now we are back to the bath. So we're looking at moisturizing. So we looked at the skin. It looks nice. Skin doesn't look too dry. Skin is a bit red maybe due to the bath and that blood flow now to the vessels of the skin. So now we're going to moisturize. Always make sure you avoid the umbilical area, because the umbilical area is quite a sensitive area now, and we have a different technique to that. We look at the bum, we get the nappy on as soon as possible, especially with little boys. They do surprise you with the baby bath. So trick of the trade, we as midwives have learned, we take good old-fashioned petroleum base like Vaseline, for instance, and we put a nice thick layer over for boys under the testes, by the bum, and on the side of the thighs, and as well as girls, we put on the side of the thighs and by the bum. So meconium is the first poo they get. It's a black sticky poo, and you can wipe, and it feels like it never gets off the skin. So we found that when we put this thick layer of Vaseline on and we're done, it actually, the next nappy change is with the breeze. And remember, we never rub the skin with wet wipes. We are always gentle on baby. Baby's skin is quite fragile. So for the first few days, if you put a nice thick layer of Vaseline, you can just wipe off gently. That should be no problem, and you'll see it comes off quite nicely. Again, the nappy may have two parts, umbilical cut out or not, but if it does not have that, we turn it gently over so that we have the belly button exposed. So nappy is on. We can now look at doing our much important umbilical area. So we just a fun fact. they actually did some research on the Vaseline and petroleum-based ointments. And it said, Johnson and Hunt said, it's actually useful to prevent diaper rash as well as to treat diaper rash. So it's a handy thing to have. So we dress baby in our vest and socks, and we put on the nappy is the first thing we do. So now we basically have the umbilical cord area. So I don't know about any other moms, but this was quite a frightening thing for me, especially with my first one. I didn't know where to touch and where to begin. So we want to wash hands before we start this. It's a sterile part of the body. It's a sterile procedure. And we want to make sure we avoid getting it into baby's eyes or any other area, even the nappy area. So before we start with doing the umbilical area as well as after. So we take 3 cotton pads, we dip it in surgical spirits. So the first one, we will swab in circular motion around the base of the stump. So we go in a circular motion. With the second one, we will go from the base upwards and we'll discard. And by the third one, we'll do the top part. So there where the clamp is, you will go in a motion. And when I say motion, it's a one sweep and you can discard your swab. And you discard all your swabs basically. So this is done every 3 hours with your nappy change. Again, you fold over the nappy, so we don't want friction on the umbilical spot. And also we found wearing cotton clothes really helps, especially vests with this friction. So you don't have that chafing of things on that umbilical stump. And now we dress rest of baby. So baby's got his cap on, he's got already his socks on and his vest, and now we put on the crawler and we can cover baby nice and warm. We can actually do our swaddling as well. We can swaddle baby nicely in a cloth. And we do look, when we did do our umbilical cord, we actually look at, very importantly, what type of smell comes out of it. Is it pussy? Is it oozy? It's quite normal to be a bit reddish, but it should become drier as the weeks go on, and it normally falls off between 5 to 7 days, depending on each baby. The size of the umbilical cord means nothing. Now, some baby will have this big, thick cord and a long one, others shorter. It's actually how the doctor also cuts the cord. It doesn't have any impact on the healing of the cord, as long as we do it 3 hourly. And again, this can be reported to your clinic sister or your doctor if you find anything abnormal. It's really warm on the surface. If you touch the skin, it really is warm and it worries you. Always, if anything worries you, mommy, you always report it. Now we have some questions I thought we may, and things I, out of my own self, actually thought of when I had my first baby coming home. So how often do we bath baby? So I say babies doesn't play outside, they're not dirty. So we can wash baby every second day, weather permitting. If it's a colder month, we obviously we can even stretch it out a bit if it's a warmer month. But I have found that a baby that's bathed is much calmer. So always bath baby before evening time. So if you want daddy to join in on the bonding, always bath baby maybe the time daddy returns from work. If you can get a nice heater in the room to heat up the room before bathing, especially in the colder months of South Africa's winter, it can be quite chilly for baby. And then with hair washing, we can wash hair every 3rd day. If we are doing it every 3rd day, at least every day, take off the cap, look at your baby's scalp, at least brush the hair. And with that, you can check for cradle cap. So if we are also bathing, maybe not every day, and you are doing the top and tail, which means you're washing the face, the eyes, as I showed you, and the face, and you may be just doing the nappy area, to look again for the eyes, look at the face, look at the skin for any abnormalities you may see. And then babies start to cry during this whole bathing regime. Mom, stop. Do look at your baby and talk in a nice, louder pitch voice. Say, mommy is here. It's fine, baby. We are busy with the bath. That all of a sudden, a pitch going up or a little decibel going up, it actually changes their focus from the crying. And they're crying because it's cold. And now they're undressed in this big, old, uncertain world. But you just get that pitch up and it really helps calm baby. Do this quite often while you're bathing baby, and you have that kind of, he gets to know your voice and he knows this is my mommy speaking speaking to me, and that's part of the bonding. The same when daddy's around. I think they would pay even more quicker attention. So during this feed, we say, do we feed baby? Yes, during the bath time, you can feed your baby. So you can actually stop, especially if your baby is a bit inconsolable. You can give him a bit of a feed. That's just to quench the thirst. And this is perfectly fine. You can wrap baby against you and just comfort baby a bit, especially if baby is really, you won't be able to continue the bath. And this is what we want. We want baby to know we are here. Baby is comforted as well. So this is just a bit of us in a nutshell on baby bath.